All right, so we'll go ahead and get started. So basically, this is the whole why stretch, why now. I know, super, super exciting, we can tell. Basically, hopefully this actually, like, there we go. So basically when it comes to the setup, obviously one of the reasons that I go over this is just because plenty of people don't understand why I start talking about this. I'm a chiropractor that has certifications in sports medicine and in functional neurology, and I have multiple other certifications. I also teach anatomy and physiology over at Owens, but this is something that, you know, stretching is obviously extremely important, and it's extremely important in my patients that I deal with on a regular basis. So when it comes to why stretching, there are so many different possibilities of when it comes to stretching, like why it might be a good idea. So, but the problem is that really when it comes down to it, most of the time you hear about cardio. People hear about cardio workouts as being one of the ways to help improve their heart health. But when it comes to other muscles or other aspects that we have, they're basically just as important. So it doesn't really matter what your level of fitness, you basically, stretching is something that should be basically part of everyday life. It doesn't necessarily have to be every day, like every day, but it should be something that you're working on overall in order to help maintain that flexibility in the muscles and, you know, good range of motion and stuff in the joints. When we end up feeling like we're stiff, you know, the muscles will shorten up, they become tight. You can end up losing range of motion, and then that can lead to issues like weakness, and for many people, extra problems with joint pains, strains, muscle damage, other kinds of stuff like that. And that's just kind of part of it. So one of the things that I kind of like to just make sure that people know is that there's two different types of what we consider to be, you know, this whole stretching thing. There's two different things that it ends up affecting, and there are two terms that people may have heard before, and there's different ways that you can define it, but there would be flexibility, and then the other one would be mobility. And a lot of times people consider them to be the same thing, and obviously they're extremely related, but it's not exactly the same thing. The best way to look at flexibility would be, you could define it as the ability of a muscle or muscle groups to lengthen passively through a range of motion. Whereas mobility is going to be the ability of a joint to move actively through a range of motion. And basically, it comes down to whether or not it's active or it's passive. Flexibility is the ability to uh, sit on your butt and bend forward and touch your toes, right? So that's just the, can you passively get down and touch your toes? Whereas mobility is going to be, how does that actually like benefit you when you actually move? Some person might be flexible, but they don't necessarily have the strength to be able to use all of that flexibility. So they don't have the right mobility, so they can't get down under the ground or whatever like they would need to. So there's a couple of different things that kind of goes along with that. And basically the way that I like to kind of point it out to people is that there's kind of four things that we need to kind of look at cultivating or working on in general. One is going to be mobility and your ability to actually move and do different things. And then if you actually have the ability to move, then you have the ability to do other skills. And what I mean by that is that, you know, when it comes to any exercise in yoga, or if you're talking about barbell type of exercises or other kinds of stuff like that, there's certain moves that you can, again, you can partially get into stuff and you can modify things to a degree when it comes to lots of different exercises. But in order to do the exercise completely right, there usually needs to be a certain amount of mobility that's required for that. Obviously, some things are a lower bar. Like you don't really need a lot of mobility to run. But when it comes to something like upward dog or other kinds of exercises, you are going to need a certain amount in order for you to be technically in the right type of position. So you have mobility and then you have skill. And then after you get those two, you can obviously improve your skill, but you would have to start working on endurance and then strengthen those different types of positions. There's a handful of things that have an effect on how we actually can deal with, sorry, I got a couple of kids that are sitting right outside, uh, hopefully not making too much noise. But we do have a couple of different things that have an effect on it. So again, mobility, skill, endurance, and strength. Now, with all of those different things being said, there are 4 different types of stretches that people typically undertake. And there's a combination of basically any of these. So the 4 different types are static. So static stretching, dynamic stretching, passive stretching, and active stretching. And basically every stretch is going to be either static or dynamic, and then it is going to have a component of being passive or active. And it just kind of depends. So again, there are multiple different things that have an effect on that. So this is one of those examples here that when you get in and you end up start talking about somebody that is getting into a position, again, there's going to be different levels to this, but obviously you have to be able to get onto the floor and be able to get off of the floor in order to actually do this exercise. So that's going to be one thing. But again, there's going to be certain components, again, as to what is going to be considered to actually be an upward dog. Because again, if you're not able to drop your hips down and you're just going straight across, then basically you're in a tall plank. So again, all of those different things have certain components to them. But the first thing that we'll go back and talk about is static stretching. And static stretching ends up being something that is fairly important when it comes down to it. Again, this is basically just holding a comfortable but a stretched position. People would do this anywhere from maybe 15 to 30 seconds or so. And basically what it comes down to is that this is probably the most common form of stretching that people do and that people know about. But even though this is the most common form of stretching, it's not necessarily the best for improving your range of motion. And there's different, all kinds of different definitions and stuff that you can go with this. But again, this is going to be able to increase someone's flexibility, but it won't necessarily improve that functional movement or the mobility that a person would have. That would be something that's going to be more of the dynamic stretching. But again, this is going to be, static stretching is going to be obviously very useful for post-workouts, cool down, stuff like that. So basically you can spend something along the lines of 5 to 10 minutes after you're done with a workout. You can also do this if you are just going to do stretching. You can do static stretching, but usually it's a good idea to be warmed up beforehand. So a person could either do something like jump rope, or they could do some other type of dynamic type of exercises or movements first, like prying goblet squats, which are one example. And that would be basically where a goblet squat is where you would take a dumbbell or a kettlebell and hold onto it in front of your body and then squat down. And that's the goblet squat. A prying goblet squat is when you're squatted down all the way down, that you're taking your elbows and kind of jamming it into your knees and shifting back and forth and trying to open up your hips a little bit more. So that's something that's going to be more of like a dynamic type of a warm-up. But again, static stretching would be a good thing for you to do after you're done doing some of those other kind of things. Doing it cold isn't necessarily going to really cause injury, but that is the general thought. So there's not a lot of literature that states that doing it cold is going to cause injury, but it also depends on how far that someone is able to push themselves and how much of a stretch that they're able to get. So when it comes to static stretching, again, the idea is that you want to keep things under tension for around 15 to 20, maybe 30 seconds. And the thing to remember is that the body does not work if you're going to be trying to do a stretch for under 15 seconds. Everybody remembers, going and, seeing the stretch reflex, or somebody, takes that reflex hammer and whacks you on the knee, and then your foot kicks out when you do that. That is an example of what's called a stretch reflex. That stretch reflex is always there in people. And basically what happens is that for the first 15 seconds or so of doing an exercise, your body is kind of fighting that stretch reflex. So if you get in and if you start doing an exercise and you're starting to stretch and you do it for like 10 seconds, then basically you're kind of wasting your time. 15 is kind of like the limit of where it is. But usually the way that I tell people to do it is I have people hold their stretches for about 30 seconds per part. Again, it depends on what the goal is that a person has, but you want to hold it for around 30 seconds or so. And when you do that, you can do it for a total of, you can do it just once, but you can do it up for maybe up to 4 rounds. Again, it depends on you, it depends on how good of a condition that you're in and everything else. But it's one of those things that you would hold a stretch, you would hold it for 30 seconds, back off for a second or two, push into it a little bit more, and try to go a little bit further. And again, you could repeat that cycle around 4 times. So as someone's, depending on, again, how conditioned that the body is and how flexible that you are, again, you can hold those those stretches for a lot longer. Again, it's one of those things where the older that a person is, so let's say that a person is over the age of 65, the recommendation would be to hold a stretch, and there's literature specifically behind this that shows that you should hold a stretch for over 60 seconds or at least 60 seconds if you're over the age of 65, if you're trying to improve your flexibility. So again, the longer that you hold it, the more benefit that you get out of it. The other thing to remember is that when it comes to stretching is that you should be stretching both sides equally. You shouldn't be really, having an imbalance or doing one side more than the other. So usually a timer is a good idea. Again, a timer is going to be better than using something like in your head or just counting, because, even if you think that you do a great job counting 1 Mississippi, 2 Mississippi, or whatever, the idea is that you could count differently from side to side, and depending on what you're doing at the time, you want to try to keep it even. Again, if it's a couple seconds off, it's not that big of a deal, but the general idea is that you want to try to keep it even. The exception could be is that if a person does have an imbalance, or if they do have tightness, or if things are uneven or asymmetrical or something like that, then maybe you do want to stretch more on one side. If you have damage to, like one hamstring, then maybe the person wants to stretch for 60 seconds on the hurt side eventually during, after you've recovered to a point, but you only want to stretch maybe 30 seconds on the other side. Again, it depends on the person and the issue and the goal and everything else. The other thing to remember about dynamic stretching is that, again, it shouldn't really be done to the point of pain or past the point of pain. And there should never be really any bouncing that's done when you're doing this static stretching. Again, you should get into it. You should feel the stretch. It could have a little bit of discomfort, but it shouldn't hurt, if that makes sense. And when you do it, try not to hold your breath. That's one of the things that, again, you're doing it, especially if you're doing it for 30 to 60 seconds, the amount of times that people will be doing these and they try to hold their breath, again, it doesn't help with oxygen and pain tolerance and all that other kind of stuff. But at the same time, if you hold your breath, it can actually make it seem like things tighten up. And then with certain exercises that we do, the breath is actually a major part of the stretch itself. So you can actually be into a position, especially if you're talking about something that's associated with the low back or the upper back or shoulders or different stuff like that, or the hips. When you take that deep breath in, it can make it seem like things tighten up. And as they get tighter, as you take a deep breath in and someone holds it, again, they don't get that benefit from it. But when they exhale after taking a deep breath in and blowing it out, a lot of times that can help people, again, relax, break through, get down to another level, and then kind of go from there. So there's multiple different things with static stretching, and static stretching is a great thing to do. But again, it's not the end all be all that you typically see when it comes to people doing exercises, like specifically when it comes to stretching. The other thing is going to end up being dynamic stretching. That's the other major kind of classification. And dynamic stretching is going to be, it's going to require a little bit more coordination than static stretching, because a lot of times you can just sit there with static stretching. It's going to take your soft tissues down to their full length. And rather just holding it, it's kind of moving through and doing maybe the movement that you would do in the sport, and doing that as part of the exercise. Again, dynamic stretches, again, are going to be something that you can do daily, and it's definitely something that's a good idea to do pre-workout. That can be something that can improve flexibility. Again, it can improve your range of motion and help to get more blood and oxygen into the muscles, tendons, and the ligaments, especially before some kind of event or something along those lines. So again, if you're doing pre-activity dynamic stretching, again, it's been basically showed to improve performance in things that have strength and speed and power, especially when it comes down to the power. If you end up having issues when it comes to exercises or things that require power, you don't want to do static stretching beforehand. And that's one of those kind of things that many people don't know. So, and this is one of those, again, going back to the difference between dynamic and passive. Again, dynamic is going to be something that you would do as part of a warm up. You don't want to really do the passive, you don't want to do the static stretching as part of um, a warm up as much, because it can decrease the amount of power. And I'll talk about that here in a little bit and how that kind of like relates and what that means. So getting into dynamic stretching more, again, you start with the joint in more of a neutral type of a position. So like the woman that's shown here, again, you would start standing, and you can use that slow type of controlled movement, extend down, get to that full end range of the movement, and then slowly come back to neutral with an eccentric contraction. Again, depending on what's going on and how you're actually doing the exercise, that could be concentric or eccentric. And again, you can do that movement 10 to 12 times. You can go back and forth. This would be something where they're doing more of the dynamic stretching in like football games and stuff for high schools and stuff like that, because it has been found to be better when it comes to like a pre-workout type of exercise. So this would be like the example of if you see like a football team that goes out and they start at the goal line, and then they do like hopping or skipping or high knees or something like that for 10 yards, and then turn around and then do something else on the way back. This is basically the example of what dynamic stretching is. So beyond dynamic stretching, you also have passive and active stretching. So when it comes to passive stretching is going to be where the joint itself isn't really doing the the stretch, or it's not pushing itself into the stretch. So this is going to be using some kind of outside assistance in order to push yourself into this. So passive stretching, like in the picture, could be like another person that's helping you. So partner assisted type of stretching, which can be really, really effective as long as the partner knows what they're doing. And as long as you know what they're doing, like if you know how to coordinate it, that's going to be something that we do in our office on a regular basis to help people improve their flexibility, especially with muscles that are basically shortened. So the other things that it could be is that using like, your body weight or a strap or some kind of leverage, gravity, some other kind of stretching device, that's all going to be passive. So an example would be stretching and going backwards over top of a ball. So there's multiple different examples of what you can end up getting when it comes to something being a passive device. So something basically doing a stretch, and if you are trying to do a straddle stretch and let your legs fall out to the sides, and you're just allowing gravity to drop you down, that's going to end up being something that ends up being a passive type of stretch. Again, the muscle in general, you're trying to leave it, relaxed in it for the most part. And it's utilizing the external force in order to kind of hold you in place, or kind of like help to drop you down. Again, passive stretches are going to be a great thing for cooling down after a strenuous workout. They're also technically, pretty much they're safe, as long as you're not doing any abrupt movements. So again, this should be one of those where there's not any bouncing that's involved. that ballistic type of stretching isn't going to be a good thing. Whereas active stretching is going to be a little bit different. That's going to be taking a muscle and it's going to be actively contracting the muscle in opposition to the one that you're stretching. So, again, there's multiple different examples to it. And there's multiple different ways that you can go into this. So this specific example is using active stretching from the standpoint of, like, for here, it's like using as you can see on here, it's like she's grabbing a hold here and she's lifting her head up towards the sky, activating these muscles, even though these are the ones that she's stretching. So if she activates this for a little while, what she can do is relax eventually, and then she should be able to get more range of motion and get her neck over more to the side. Again, this kind of stretching can take a little bit of practice because you do need to have a muscular force required in order to generate the stretch. The other way that you can also look at active stretching, and this is where there ends up being, like, again, things aren't perfect on the way that we have definitions, because you can have active stretching be here and trying to counteract it, or you can end up having her trying to actually bring her ear further down with the muscles on her neck. And this is where you can end up having differences. Like when the example that I have before, in one, when I talked about doing a straddle stretch, that straddle stretch, again, it's going to be active in a sense from the sense that you're not going to be able to completely let go of the muscles on your adductor muscles when you're doing that straddle stretch and when you're trying to drop down to the ground, but you're still using the gravity in order to passively push you down into it. So there's always going to be different things that go back and forth. You can also look at, if from the standpoint of doing a straddle stretch, if you are actively trying to open up your legs more, again, one would be just letting gravity drop you down and you're using your muscles to hold you there in place. The other one would be you're actively trying to spread your legs further apart. Again, both of those have a little bit of there's a little bit of play that goes in between there with what you can call active versus passive. So again, everything's not absolutely clear cut when it comes down to it, because you can have multiple different definitions and you can have like a lot more categories to it. But again, basically, this is low risk from the standpoint of you're typically using your own strength and your own the force that you generate in order to do the stretch, as opposed to the other example, which passive stretching, when someone else is doing it, if you're doing partner assisted stretching and they're passively pulling you through or lifting your leg up, they might not know when to stop and they can push you too far. And then there's a possibility of getting injured there. So you just have to be a little bit careful with that. So the benefits when it comes to stretching, again, everybody knows that stretching is a good idea, but not everybody knows why specifically. So when it comes to the benefits of stretching, again, obviously the main point is that increased flexibility and the range of motion, hopefully leading ultimately to more mobility. Again, flexibility can get a little bit worse as we get older, so that's why it's important to maintain. And it doesn't really take all that much to maintain what you've got. It's harder to make yourself super flexible when you're really, really tight. But once you get flexible, it's a lot harder to lose it compared to somebody who's been having other kinds of stuff. So when it comes down to it, there's also improved circulation is another thing that can be a benefit of stretching. Again, using the muscles, getting rid of waste products and getting those muscles moving, having better posture, again, keeping muscles from getting tight. Again, specifically certain muscles in the body have the tendency to get tight. Other muscles have the tendency to be a little bit weak when it comes down to it. There is obviously a stress relief that can happen. So making sure that you do your stretches can help to relax those muscles that end up getting tense. Coordination is another thing. Making sure that your body actually like goes through and holds those different positions and maintaining the balance. Again, that can help improve your coordination. And the other stuff is that you can also get a little bit more power, better endurance from holding yourself up in certain positions, more efficient like muscle contraction, an increased speed of contraction, and you can actually use that to wake you up. So you can be more awake just by moving around and getting your body going. So there's a lot of different conditions that can be helped by people that stretch on a regular basis. One example, like there's multiple examples, but for one thing, again, low back pain. Again, that's going to be one of the most common conditions that you can use stretching to help. You know, there are some instances where stretching can be bad for low back pain, so it does kind of depend on the person and what they have going on. But you know, somebody that's doing a long time during the day sitting down, that's going to help to shorten up the back. It's going to tighten those muscles, and it can cause tension on the joints. The hips obviously are another area that usually have a lot of tension in it. We have a whole bunch of tension typically in our hips. So there's multiple different types of stretches that you can do for the hips to help to open them up. And that can help to release some tension and some soreness. Sometimes it also releases a little bit of emotion too in people that have a lot of hip tightness. So it just kind of depends on the person there. Hamstrings can also be super, super tight in a lot of people. And even with regular stretching, again, hamstrings can really take a long time to get in there and loosen. But working on that stretching on a regular basis can help to improve flexibility there. And again, that's one of the things that has a tendency to cause low back issues, among multiple other things. And then obviously the main place that people like to hold their stress is in their neck and in their shoulders. And so whether or not it's getting text neck, or you're having other issues with spending hours like hunched over playing video games or looking on your phone, or, you know, the perfect position that you always sit with when you're on your couch and you're, you know, watching Netflix or whatever it is. You know, obviously we, you know, slump in our couch, or we slump when we're driving our car or other kinds of stuff like that. So there's multiple different things that have a that are affected by that not so great posture and the stress that you place yourself in. But again, stretching can help to kind of combat that. So there are some precautions though, and some stuff that you just kind of have to, you know, just be aware of. So just like any other type of exercise, there's potential risks when it comes to doing stretching. And it happens for specific types of populations. And it could be that it might be just contraindicated, or maybe a bad idea to do it in certain muscle groups, but sometimes it is the whole person. Now, remember that that mild discomfort from the stretch may be experienced, and that's different than pain. So some of the different kind of things that you might have to kind of pay attention to is that there's special populations of patients that may have problems with stretching, and they would either need to be under like medical care or get a note from their doctor, or if they're seeing their chiropractor, having a health professional kind of like work through that with them in order to work them through the stretches would be a good thing. So seniors might be a good idea to actually make sure that someone gets cleared. If a person has hypertension or high blood pressure, if they have certain types of neuromusculoskeletal disorders or joint replacements, all of those people, you know, you have to be careful with it. And then there's some cases where you absolutely don't want to do stretching. If somebody has osteoporosis, that can be a clear contraindication, because again, if it's bad osteoporosis, you can't get broken bones from pushing through, because you're using the bones as levers in order to basically stretch out the muscles and the joints. Another thing would be if a person has acute rheumatoid arthritis. So in the joint that they have that's being affected or being attacked, that would be something that you wouldn't want to stretch. So you're not really going to be stretching out their knuckles if their knuckles are being attacked by the rheumatoid. You know, same kind of thing with the hips or the neck or any of that other kind of stuff. And then the last one would be, and this is something that is hard sometimes for people to remember, but somebody that's sustained an acute injury to the muscle, or, you know, even a ligament, you know, doing stretches to something that just got injured is not a good idea. So if someone pulls their hamstring, it gets tight, and then people have the tendency to feel like they should be getting in there and stretching out their hamstring on a regular basis. And that's just not a good idea. Remember that part of the idea is that when we're doing those stretches, especially if you're doing that static type of stretch, what you're really trying to do is you're trying to get in there and like partially tear the muscle. So if you've already injured the muscle and you've already partially torn the muscle, by doing a strain or something that's a little bit worse, getting in there and trying to stretch it even more is not going to be helpful at all. So there's multiple different kind of things to work at with that. And then the other thing to kind of like remember when it comes to these precautions is that it depends on what your goals are or what your sport is. When it comes to doing any of these stretches, there's hundreds of different stretches that you could be doing, for basically each joint. And there's a whole bunch of different stuff that can be done, but just because you can doesn't mean that you should. The idea is that if you should be focusing on the muscles that are tight first. Some people are going to be super, super flexible, right? So for example, like in this picture here, if this woman can reach her hand down and touch her other shoulder, and if she can reach her other arm up and back and grab her shoulders behind her in the back, she just need to work on doing shoulder stretching exercises, right? And it's basically, you need to do something that is tight. You need to work on it and not just try to get something that's already flexible more and more and more flexible. So the general rule of thumb is that when I give patients like uh, a stack of exercises to do or a stack of stretches to do, the rule is that you kind of, if it sucks and if you don't like it, then those are the ones that you need to do. If it's really easy and you kind of like doing it because it's easy, then you probably don't need to do that exercise. And again, not everybody needs to be super flexible, but you need to be flexible enough. So the example that you can use is that a power lifter is one of those people that do bench press, deadlift, and squats, and they do it to lift as much weight as they possibly can. Those people, if they have more flexibility, it actually hinders their ability to actually lift as much as what they can, because joints always have a constant battle between being stable versus being mobile. And the more strong that someone is and the more weight that they need to lift, the more stable that joint needs to be. And that's going to take away from the mobility. The more mobile that a joint is, the less strength that joint is going to have, and the less that person is going to be able to lift through that joint. So power lifters are never going to be flexible, and you don't necessarily want them to be flexible. And the same is the case when it comes to runners. Runners, you need to be able to move your leg a few degrees forward and a few degrees back and be able to cycle back and forth with your knees. So hip flexibility isn't something that's super important for people that are running. One of the things that I, talk to people with on a regular basis is that, if you're not fighting in the UFC, then you don't have to be able to kick somebody in the head. So you don't need to have to be able to get your foot all the way up to someone's head and do like side splits or do front splits in order to do that, because again, it's not really giving you any benefit. You think about certain things and like the activities of everyday type of living, right? Like if you're a dad, you need to be able to get on the floor and wrestle with your kids. You need to be able to get down and get up. Like a good example would be, a person should be flexible enough and strong enough to lay down on the floor face up and get up to standing without putting your hands on the ground. Don't use your elbows, don't use your hands. Can you sit up and then move yourself around enough and be strong enough to get up to a standing position without using your hands? And again, that's a pretty good indication. If you can do that, that's actually pretty good. But there's a whole lot of people that don't have the strength, or they don't have the flexibility, or they don't have either. And both of those things, like you need to be able to, be able to do what you want. So anyway, there's a couple of different things with that. So moving on. So when it comes to getting started, the thing about getting started is that, one stretch isn't going to do it. You're not going to be able to go through like a 10, 15 minutes of a stretch session, and then all of a sudden you got all the flexibility that you want. This is something that is like a long-term type of a thing. Really, when it comes down to it, like if you're really talking about real flexibility, again, we talked about before about that stretch reflex. You have to let that stretch reflex relax over and over and over and over again in order to get down to what the actual endpoint range is. If what you're just trying to do is maintain, you could do 30 seconds and do 1 to 2 sets of that. So a minute total of stretching, per day, and have that be it, and you're done and you don't have to worry about it. But you need to, If somebody's really trying to open up their hips and get a lot more flexibility, then they might need to do 15 to 20 to 30 minutes of stretching in a day, or maybe 15 minutes a day, but then it needs to happen for months and months and months. And you have to really go after that in order to get results. And so again, time and patience are key. Your muscles didn't tighten up overnight. If you can imagine, like in our culture, we don't squat on a regular basis. In other cultures, that squat when they go to the bathroom, because we can usually sit on toilets. Again, you talk about in Asia and in other places, like a resting position for people will be to just squat down. So opposed to standing when it comes to waiting for something to happen, a person will just like squat down and basically bring their butt to their heels, and then that's their resting position. Most people here aren't going to be doing that stuff. But if you look at a kid, most kids, especially like younger ones, if you're talking like 2, 3, 4, 5, stuff like that, they can squat down and they can do that and they can play while they're squatting on a regular basis, and it doesn't bother them at all. And again, you were probably like that. But the thing is that, again, it took a while for your muscles and your joints to tighten up, and it didn't happen overnight. So you can't expect that, just doing a couple of sessions is going to be realistic in order to get massive improvements in your flexibility. Again, it can take weeks or even months in order to get flexible, but you have to be committed to it. So, but you don't necessarily absolutely need to do every muscle every single day. The idea is that, again, you don't necessarily need to work on like, stretching out your forearms and everything else. You can go for the main ones that a lot of people end up having tightness in. So your calves and your hamstrings, the hip flexors, so in the front of the pelvis, and then the quadriceps in the front part of the thigh. Those are some of the main ones. And then obviously there's some stretches for the neck and the shoulders and the low back and that kind of stuff that you can actually get into. And again, you don't really want to stretch muscles, if they're not warmed up. So you want to try to get some kind of little bit of a workout in, again, jump rope or something like that, just to kind of warm things up. Again, it can be even like a light walk, but you can do something in order to get yourself warmed up so that make sure that you don't have any injury. So when it comes to, again, workouts, again, dynamic stretching is going to be typically the one that you're going to want to do. So you can do lunges, you can do high kicks. There can be other stuff like push-ups or jump squats or different stuff like that. Again, any activity that's engaging the same muscles that you'll be using during your workout is appropriate. So post-workout stretching is going to help to reduce tension in the muscles, and then it helps to kind of like cool you down. And then it also helps that's the point where you can really start working on getting a little bit more flexibility and more of that ability to go a little bit further into a stretch. Okay, that's going to be after the workout, is going to be doing more of the static. So beforehand, you're going to be doing more of the dynamic, and then afterwards, you're going to be doing static. So other places that you can work out is stretching at work, right? So stretching at work is going to be something that can give you a quick boost. It can help to prevent injuries from all the repetitive motions that you do at work. This is an excellent thing for someone to do for micro breaks. So what that means is that, in general, you shouldn't be, whether or not it's working or studying, you shouldn't sit down at a desk and work for 3 hours straight. That's actually going to slow down and not do well for your productivity, because your brain is going to start to wander. You're going to have a hard time concentrating, that kind of stuff. But taking micro breaks is a good idea. So whether or not it's studying or not, a person should study for a half hour or maybe 40 minutes and take a little bit of a break and then get back into it, right? You don't want to break too often, because then that will mess up your flow. But if in general, if you're taking micro breaks, that's something that can be really, really good for productivity, as well as helping to prevent extra issues with like repetitive motion type of injuries, hopefully preventing carpal tunnel and other kinds of stuff like that. So everybody that's here on the webinar, I'm going to send out a sheet. I'll email a sheet on some just general exercises to do that you can do during micro breaks. And then later on, when this is on YouTube, I'll also make a link available for anybody that's interested to get a hold of that that as well. So, so some examples that you can do though, when it comes to stretching at work, again, the stretching that you have there for the neck can be a good idea. Um, Overhead arm stretches, again, moving your arms up, trying to stretch and like reach towards the sky as hard, as high as you can, even standing up and reaching up like you're trying to reach up and like pick an apple off of a tree. Then you have to get up on your tiptoes for it. Again, those could be examples of different things that you can do when it comes to stretching at work. Obviously, taking a little bit of a break to go and walk, to get up and move around, whether or not you're in your office or whether or not you're at home, it doesn't really matter. You can, figure out a way to do some of these things, go and, talk and walk at the same time. If you're having a meeting and you have that ability to do that, if you don't have to take notes, and if it's just, that's something that's a possibility of walking around, either outside, again, depending on the situation, or even around in the house as you're walking around, you might actually, that might help to turn up some good ideas too. It's kind of funny how the brain works. You can even do a few squats to get the blood moving a little bit. So there's a couple of different options when it comes to that. So now, I know we talked about it a couple of times, so obviously you're not going to necessarily be able to respond to this, but when you see this kind of stretch that's going on, first of all, you're like, wow, that's kind of amazing that somebody can get in there and do that. But when she's doing that, would you say that that's a static stretch or a dynamic stretch? I just want you to think about that for a sec. And then once you have that answered, should she be doing this more before her workout or after her workout? And again, there's differences with the ways that, things have been taught over the years. Again, people that played, you know, several years ago played like sports like in high school, and if it was like 15 years ago or more or whatever, even 5 years ago, people might have had the tendency to be doing things not the way that they should be. So when to answer the question on this one is that this one would be a static type of a stretch, and the right answer is that this should be done after a workout. A lot of times in the past, again, people have done static stretching, and it's not necessarily absolutely wrong to do static stretching before a workout, but again, you need to warm up, and part of the warm up is doing what it is that you're doing. So for example, when you look at this kind of picture of her, again, it's kind of hard to tell specifically what it is that she's doing, but she's either a cheerleader or she's a gymnast, right? And the question is that when she's doing this, the way that you kind of like help to figure out like whether or not somebody should do this before a workout or after a workout is to determine what is actually the workout. So if she's going to compete, which again, by looking at her makeup that she's got, she's probably going to be competing. The way that this should work is that she should be doing this after the workout, right? After she's competing, after all of that other kind of stuff, right? A little bit getting into it and popping out, but you definitely shouldn't be holding this for 30 seconds, right? Or a minute or any of that other kind of stuff. And the reason why is, not necessarily because of injury, even though the idea of doing this is going to be tearing muscles, like the idea of doing this is really going to be tearing some of the muscle in the back of the hamstring. And when I say tearing, I'm talking micro tearing. I'm not talking about like actually damaging it, like and actually getting an injury from it. But the idea is that you're getting in here and you're stretching this stuff out. But part of that whole process of going in there and having that and stretching that out and doing the micro damage to it is that actually has an impact on the amount of power that somebody has, right? So when someone does stretching, and again, there's different data that they have on this, but basically when it comes to doing static type of stretching has the ability to change the person's power output for anywhere from a half an hour to an hour after you're done doing that exercise, right? So what that means is that later on when she's, let's say she's doing some kind of tumbling and she's got to do a bunch of like back handsprings and other kinds of stuff like that, the muscles that are in here are going to be reduced in their power output, which means that you're not going to be able to actually develop that strength quickly like that explosiveness isn't going to be there as much as what it could be. Now, again, it depends on what the sport is, and it depends on what it is that you have that's going on, right? When it comes to gymnastics, to stretch and to go straight out and to go and do the thing and have like the exercise, is not necessarily going to be the best thing to do it. Again, it's different if you're talking about someone who is a long distance runner, right? If you're talking a long distance runner who's going to be doing cross country, the stretching beforehand, not necessarily like the best thing, because again, if you're talking about shorter distances where a person is going to be running for less than an hour, again, that's going to decrease their ability to develop power, and it's going to decrease their speed at the end of the run, right? It's different if you're talking about somebody who is doing a marathon and is doing, let's say that a person is doing a 3-hour marathon. When it gets to the end point, when everybody starts ramping up their speed and sprinting, at the end of 3 hours, you're not really having that effect as much if you did static stretching beforehand. So a 5K, a static stretch, definitely, probably, like I would say, it's not a good idea at all, right? But what should the person be doing? Because at what point during the run is the person going to be put in this position? They're not going to be needing that full range of motion when they get there, right? So you have multiple different factors, and is the person going to be doing an exercise, doing that part, or need that range of motion of the exercise during the exercise? Probably not. But a runner after it and after everything is warm can help to increase their flexibility. Again, a runner is probably not going to be getting this type of pattern. It's just probably not happening. But that's kind of be one of the things and one of the factors that we have when it comes to all this. So stretching during pregnancy is another thing to kind of think of. Again, exercise in general during pregnancy, the way to kind of remember it is that anything that you have been doing, you can keep doing. But again, stretching is an easy way to help feeling good and help to stay a little bit more mobile when pregnant. So again, there's a lot of undue stress that's on the body, extra weight and all that other kind of stuff. But muscles that you can target for sure are the upper back, the lower back, the legs, and the hips. And again, trying to move slowly through the stretches. Person should be listening to the body, and then obviously not pushing through to the point of pain. Another thing that you can end up having is, again, stretching for seniors. So you want people to make sure that they're healthy enough to do it, make sure that they're putting enough time in. And they're, somebody's a little bit older, and if you got a little bit more time, you can put a little bit more time in it, per week or per day, right? So I would say that a person should be doing a minimum of at least 3 times a week if they're a little older. So we'll say 65 plus, right? At least 20 minutes or so in order to help to improve that mobility. Somebody that might have had surgery, again, needs to talk to a healthcare provider to make sure that they don't aggravate any kind of past injuries. But when you're starting it, regardless of the situation, you can always start slow. You can always utilize props. So use like a chair for support, or if you got yoga blocks or other kinds of things like that, blankets, pillows, whatever it is that you need. You can build up to longer hold times. So you can do, a little bit shorter at the beginning, and as you get stronger and more flexible, depending on what type of exercise that you're doing, you can hold it for a little bit longer. And again, always remember that you got to breathe through those stretches instead of just holding your breath. People do that a whole bunch. When it comes to neck stretches, there's a bunch of easy ones that you can do. The stretch that's shown here on the picture is just going straight to the side, and it's just bringing your head over. You can use a little bit of like relax your arm and use that to kind of like add a little bit extra, but you don't want to really pull, if that makes sense. You don't want to like really tug and like try to like pull it open, but a little bit of extra overpressure can sometimes be good. But again, going into flexion and bringing your chin down to your chest or looking up towards the ceiling, again, you can, go to chin to chest and like rotate your head left and right, or you can look up towards the sky and rotate your head left and right. Again, moving around. Hopefully you don't hear too much noise as you're doing all of that. You can hold in some of those positions for a count of 10 and you can go through, or you can just, sit there and look straight to the left as far as you can and look to the right as far as you can. And if you're a side sleeper, or if you're, I should say, if you're a stomach sleeper, you should notice that if you look to the left and you look to the right, then you will probably have the tendency to actually be able to turn your head further one direction than you can in the other direction, because the one that you can turn further into is probably the direction that your head is when you go to sleep at night. And that's just one of those things. Uh, Shoulder stretches. Again, shoulder stretches can, there can be multiple different things like arm circles, again, moving it across in the front. Just like she is, where you're pulling it in, that's going to be stretching out the backside part of the shoulder. You can roll your shoulders back and forth, where you can pick them up and roll them back and down, and get a good fluid motion going with that. You can do arm circles, where your arms are going out to the side, and that can be an excellent type of stretch. The other one that we had mentioned before, with the woman trying to reach behind her back and one hand over top of her head and the other hand reaching up and behind at the small of her back and trying to grab your hands from behind. Again, those are excellent shoulder stretches. Again, you can go one direction and then go the other direction. Obviously, if a person can't do that, which a whole lot of people can't, I'm one of them, one of the ways that you can end up doing that and to make it a little bit more effective is to use a towel or something like a stretch out strap in order to grab a hold and pull in one direction and get a little bit more of a range of motion with that. So those are a couple of different examples. Upper back stretches. What's being shown here is a cat and cow, or a cat and camel. It depends on who's talking about it. But this is an excellent stretch for your upper back. Again, this is going into the top position, where somebody would be looking like an angry cat, right? Making sure that you roll your hips back as you do this, right? The other direction, the cat part, or I'm sorry, the cow part or the camel part, depending on who you want to talk to, again, would be going the other direction and like trying to arch, dropping the belly to the floor as much as you can, and then rolling the hips down and forward to try to create as much of a valley here between the shoulders as you can. That's going to be really, really good. And that's the direction that truthfully most people can't go, right? This direction is a lot easier for most people to do, because this is like the slouching or the slumping type of a position. But going into like upward dog was another example that we talked about that was shown before, where the person is on their toes and on their hands and they're coming up and with their head up and looking up towards the sky. That's another example of a great upper back stretch. The upper back area in a lot of people has issues when it comes to mobility. So thoracic mobility in the back, can be a hard thing to get. But a lot of people have lost it. So it's something that is worth working on, because it helps your shoulders, it helps your neck, it helps your breathing, it helps all kinds of things when your upper back has better flexibility. So again, this is another arm stretch, arm and shoulder stretch. Again, that's the towel one that we were talking before. You can also do stretches with your arms, where again, you're trying to, like if you were in a praying position, or if you were, and trying to stretch out the inside part of your forearms, or if you were talking about flipping it back the other direction, and if you were flexing your wrists, so like you were kind of like in that, like it's considered to be like a reverse prayer type of a position. So if you were basically taking the back of your hands and pushing them together, or if you were flexing your wrist and holding it straight out in front of you, that's another one that you can do. And again, those can be especially good for, people that have tennis elbow or golfer's elbow, to get in there and start to stretch those out. Again, low back stretches, this is that cow kind of position or the camel kind of position, by having the arch that's there. Again, this is a low back stretch, but at the same time, it's still going to be an upper back stretch. So this is a great one to do. Other ones that you can do for the low back would be bringing your knees into your chest, or lying on your back and letting your legs kind of lean to one side or the other. You can even stick your legs straight out and bring it up and over and get a good twist in your back, while you're keeping your back firm on the ground and twisting your hips over and trying to get a good stretch out of that. That's another excellent one that you can do for the low back. And again, all of these shouldn't be causing pain. If a person had pain when they were doing any of these, you shouldn't be doing that stretch, right? It's one thing if it's a little bit of the discomfort, or like it's, things are a little bit tight and things are hard to breathe or whatever, but none of these should cause pain. And again, none of them for sure should cause like pain radiating down your leg or radiating down your arm or any of that other kind of stuff. You know, another one that you got here is another hip stretch that you can do. So again, this is going to be obviously a way more advanced kind of a thing. I think I might break myself if I got into this position. But again, this is going to be getting in here and trying to work the hips. So a piriformis stretch, an easy piriformis stretch that you can do if you're in a sitting position is to cross one leg over the other leg while you're sitting, and then grab a hold of your ankle to make sure that it doesn't slip off of your knee. Kind of push that other knee down towards the ground and kind of bend forward until you feel a little bit of a stretch. You can also do a butterfly, and a butterfly is going to be when you're sitting on your butt and you put your feet together in the center, and then you grab a hold of your ankles and try to push your elbows down to the ground to try to open up the short adductors that you have, or the groin. Another one that's great is another version of a piriformis stretch is called the pigeon. And pigeon pose is an excellent exercise to get in. And basically that's probably going to be easier to like actually Google that one, to be honest. But basically what you're going to be trying to do is you would get down on the ground and you would try to pull your foot up into the side while you're trying to sit back on it. Well, let's just say that the best way to example this is that it would be, this is kind of pigeon pose, the way that this woman is right now. If she were to drop this leg and have it straight out and bring her elbows back over this way, she could be up on her hands, or you can go down on your elbows and come down. But the way that this foot is coming out and through here, this is going to be pigeon pose, and this would be working the back of the hip on the opposite side on this woman's left leg. So that's an excellent exercise. But like I said, for pigeon pose, I would just recommend Googling that one. Another exercise that's fantastic, again, you can do exercises like this. This would be something that is okay when it comes to the calves. This one is an all right one. I'm personally not a fan of this because the way that the foot is sitting here, it does have the tendency in a lot of people that can either help them to develop plantar fasciitis or aggravate it if they do have it. So I prefer the one where it's like the typical runner stretch, where a person has their hand up against a wall or on the back of like a bench or something like that, and has their legs straight out behind them, stretching the calf. There are two different stretches for the back of the calf. Those are going to be a little bit hard to explain here, but maybe we'll do some demonstrations later on in a different video. The quad stretch is the classic one where you stand up and as you're standing, you reach back and you grab one foot and you bring your heel to the butt. When you are bringing your heel up into the butt, the important thing is to make sure, and this is the one that's great about this stretch that most people don't necessarily pay attention to. You need to make sure that you keep your knee directly underneath your hip. And when you're in that position and you're keeping your knee underneath your hip, you would squeeze your butt. So as you squeeze your butt or you squeeze your glute, you would hold that position, and the squeezing of the glute basically makes it an active contraction, which is basically pulling that joint in a little bit further. So by making that go, it's something that you immediately feel it in the front of the leg and even up in the front of the hip in a lot of people, and that is an excellent stretch. The other one that's a good one is the hamstring stretch. And the hamstring can be done in so many different ways. It's, almost unbelievable. There's the hurdler stretch that you can do. The hurdler stretch is the one where you're sitting on the ground with your leg, with your foot kind of up near your hip, and like you're jumping over hurdles, obviously, which is why it's got the name. You can have your foot wrapped around with your foot touching the other leg. And that's another type of hamstring stretch. But most of the time, what I can tell you is that you have to be careful about the hamstring stretch, because the hamstring stretch, people will push into that stretch. But for the most part, they have the tendency to try to bend forward to touch their foot, which means that the person is bending their back. And when they flex their back, you end up not really getting in and stretching the hamstring. So even though I might be not quite as flexible as what I was when I was doing Kung Fu on a regular basis, but even then, when I was more flexible than now, and I could kick, forward up to my head, right? I could still get a excellent stretch on my hamstring with basically leaving my foot down on the ground. It has to do with the position of the pelvis and whether or not your pelvis is tucked under and more of what's called a posterior pelvic tilt. Because if you're posteriorly pelvic tilted, then you can basically um, go fairly far without getting a stretch, and that's going to be all low back, as opposed to an anterior pelvic tilt, which is going to actually stretch out the hamstring. So if you kind of like stick your butt out in the back and tip your, like, basically try to bring your belt buckle to the floor while you're standing, right? That kind of a position is going to end up basically putting you in a anterior pelvic tilt. And if you're standing, and especially if you kind of crouch down a little bit, you'll be able to get a very good stretch on your hamstring out of that. But again, that's something to just kind of point out because a whole lot of people do that stretch wrong. Again, ankle stretches, again, we already talked a little bit about this when it comes to the calf, because that's technically part of the ankle, but this is going to be more kind of like rolling the ankles back and forth. So you can stand, you can go up and down on your tippy toes and go as far up as you can. If you're actually on a step, you can drop down as far as you can. But then it's in and out and trying to roll on the outside part of your shoe and then roll to the inside part of your shoe. And again, you shouldn't have pain when you do it. You have to be careful and make sure that you don't roll an ankle. If you have weak ankles, then this is not going to be a great thing for you to do. But the other thing is that, like she's doing here, she's going to be doing ankle circles. So you can do it with your toe down on the ground, or you can do it with your toe free and, just moving around. Either way, those are all good exercises to do when it comes to getting things moving. And again, this would be one of the examples of a wrist stretch. So this is going to be getting the stretch going the one direction, and you're going to be stretching what's technically considered to be the anterior aspect of the forearm when you're doing this. Or you could flip this around and go the other way. But really, from that position, it would just be better to just kind of grab a hold of your fingers and kind of, with your hand fully extended like this, bring your fingers back towards you, and you're going to get a really good stretch on the posterior part or the upper part here when it comes to your actual forearm. So there's a couple of excellent exercises that you can do there. So some mistakes that people do when it comes to stretching. One of the biggest mistakes, again, is going to be not warming up before you start to stretch. Again, you don't want to really get in. The likelihood is that you're probably not going to actually injure yourself, with the exception of trying to push yourself too far. Like if you know that you have a certain amount of flexibility after you've been working, and if you try to get into something without warming up, then one of the things is that you might try to push yourself too far into it, and then that could actually cause some injury. Another one would be not stretching enough. So if you are not pushing and doing it on a regular basis, then it's not going to be helpful, right? If you're only doing it once every 2-3 weeks, you're not going to make any progress, and you'd basically just be pretty much wasting your time. So when it comes to another thing would be working on the wrong type of muscles. So if you're working on muscles that are weak and they're not really tight, then that's going to be something that's going to be problematic. If you are working on, again, if you're working on muscles that are just weak, then that's not going to be a good thing. If you're not paying attention to your breathing, again, holding your breath can be something that can be very problematic for people. You shouldn't be tense in the muscles. You should be trying to relax. You should be relaxed with your breathing as well. And again, it also is a good thing to make sure that you have the right amount of oxygen flowing as well. And then you also have the stretching injured muscles. So again, if a person has damaged a muscle or has hurt something and you're stretching it, you can stretch it too soon. There is a point, and again, it's one of those kind of things where it's difficult, but if somebody does have a hamstring strain, I will start by helping them to, get better and do different kinds of either taping or Graston technique or other kinds of things like that. But at the beginning, they don't stretch. Eventually, they need to start stretching. And it depends on the person, and it's kind of, it depends on the individual on when they should actually start to stretch. That shouldn't be something that's an automatic, you get in there and stretch it all out, because you can actually cause things to be prolonged and make the recovery a lot longer. So that's basically it. If there's any questions, obviously you can put something in the chat there. Appreciate you taking the time to be here in the class. And obviously we covered a lot of stuff. Hopefully it wasn't too boring. If you have any questions, again, you can post them in the chat here, or later when it's on YouTube, obviously you can post them in the comments below. And that is about it. If you have any questions, obviously you can contact the office, get you in there and have you get a good workout, make you do something that's actually like appropriate for yourself. So if that's about it, I appreciate it, and I will see you later. Thanks.